Is nutrition really that important for health? Is it really the thing that we should be focusing on no matter what type of clinic we have? Let's find out. Welcome everyone, Doug Grant here. Welcome to Holistic Professional Success. This is a podcast for clinicians and holistic practitioners all over the world to be able to get tips and help to be able to keep that balance, that holistic balance, to be able to help their patients reach optimal health. And today we're going to be talking about the area that is controversial with a lot of people, and really it shouldn't be, and that is the area of nutrition. Many times we hear nutrition's most important thing that we should focus on, and others say, oh no, it's about the importance of the integrity of the spine and the nerves, or it's the most important thing is exercise, or it's a mindset, whatever it might be. The fact is all are important, and if any of them are missing, we have ill health or we have dis-ease. That's why you're a holistic professional. But when it comes down to the importance of nutrition, it really ranks right up there as one of the highest, if not the highest priority. And research and time has proven that. So let's get into it a little bit to see why nutrition is so important, but also take a look at how it should be applied in a clinic setting, in a holistic setting. So a long time ago, way back in 1989, I was searching for what is the area in the field of health that I really should go into. I was going to school. I was taking a look at a lot of different professions. I was looking at physical therapy, looking at chiropractic. Naturopathy was just now blooming. There was like 2 colleges, I think, in the nation that were doing it as far as certifying that. And looking at medicine, anesthesiology, all kinds of things. And I had this thing happen to me as I was going through already doing a lot of my nutrition courses and getting your basics out of the way, and really feeling this draw toward nutrition and seeing the results in my life and in others of the ones that would apply proper nutrition. And so I was kind of heading down that road, but I had an accident that happened, and I was up on some scaffolding and working in a tire shop, and I grabbed a tire and the scaffolding broke. It was like a 2x6 board. It broke and I fell to the ground, and there was a big tire there, but I was facing the ceiling. So the tire broke my fall. It was right in the middle of my back, but my feet and my head hit the ground while I was facing up. So it caused a little bit of damage, had a spinal cord concussion for a while. Couldn't walk, went through that whole situation. But during that time, it became apparent how important nutrition is, and how when it's focused on by a practitioner, when their profession or their specialty is, chiropractic, surgery, physical therapy, whatever it is, those that practice nutrition as a part of it got so much more success. And the ones that didn't practice it or didn't understand it or actually didn't give it much credence always had the problem, and always will have the problem, of some patients healing faster than others, some patients not healing at all, and not knowing why. And it comes down to nutrition. So when I was going through my situation, it became obvious that doctors weren't communicating with each other. Nutrition wasn't that big a deal for the majority of the doctors, at least in the medical realm, especially in the early 90s, late 80s. And it really signified to me and brought home the importance of nutrition. And that's when I decided to go much more heavy into that world, into the organic chemistry side of it, find out on a cell level about delivering nutrients to the cell level. And it became this big eye-opener for me when I looked at the studies and saw why some studies got results and others didn't, or why certain practices and adjustments or surgeries or these types of things got results and when some didn't. Many times it came down to the nutrition level, the nutrient level, saturation level at the cell level, in the bodies, in the muscles, in the tissues, in the brain for patients, in order for the body to react to whatever it was happening, whether it's a reaction to the adjustment, a reaction to the surgery, a reaction to the chemical. And if the nutrients were present, they'd get a good reaction, they'd get the results. But if they weren't present at the cell level, then many times that they would cause more harm than good. It wouldn't be that wouldn't get the result they're looking for. It would actually cause more harm. Like, for example, if you're doing an adjustment or you're doing a surgery and the muscles don't have the nutrients to react and to be able to rebuild, then you actually can cause, with trauma, more damage that the body is adding to the damage it already has, and you're actually causing more of a catabolic, a catabolism effect in the body, and there's a problem. Versus if the nutrients are present, when you do create a reaction in the body, either forcefully or through a drug or through surgery, the body's nutrients are there and they can heal and become better than before. So nutrition is a huge factor. Let's go through a couple things. Surgeon General, one of my favorite Surgeon Generals in history, C. Everett Koop, he said, "You, the individual, can do more for your health and well-being than any doctor, any hospital, any drug, and any exotic medical device." And he led into the importance of nutrition and that sort of thing. And we all are familiar with Hippocrates, "Let food be thy medicine and medicine be thy food." One of my absolute favorite quotes. I think it's misused now and talked about, but not applied as much as it should be. Many clinics around the world that I've gone into have this quote up. I'm wanting to put it on a big wall here in the office. And it is critical, but if you really look at it, what Hippocrates is saying is the importance of nutrition, the importance of food being your medicine, and medicine being the food itself. And just understand that that's the core value of what we're talking about. And so when we talk about nutrition from a dictionary standpoint, like Dorland's Medical Dictionary, it states that nutrition is the sum of the processes involved in taking in nutriments and assimilating and utilizing them. And that's the difference maker that I want to point out to you in the podcast today, is nutrition isn't just about eating healthy foods, telling people to get off processed foods. It's not. Look at the definition. It's about taking in the right nutrients, right? Bringing the right food that we talk about. That's usually where it ends, though. But also being able to assimilate and utilize them. In other words, break the foods down, digest them down so they can be assimilated into the bloodstream. That's still definition of nutrition. And the third part, utilizing them at the cell level. So even once they get into the bloodstream, if we're able to digest them down, break them down so they're in the gut, they're absorbed into the bloodstream, we still have to get them utilized at the cell level. And that process in itself is nutrition, not just the eating, but the assimilating and the utilizing. And so once I understood that, I'm like, oh my gosh, we're missing this. You know, we have a lot of people that are teaching people to eat more vegetables, eat your berries, eat healthier whole foods. And we got to find a better way to do it because most people aren't following that. But we know that that's being taught. We know that that's important. If you talk to people, they're like, yeah, I know it's important. But what's not understood is the assimilating and utilizing factor. And that's why I'm so big on enzymes and pre-digestion and eating raw foods. And when you don't, taking back the enzymes, because if you don't focus on the assimilating, utilizing part, it's not even true nutrition. Nutrition is the sum of the processes of all three of those. So it's the relationships of food is to the health of the human body. That's really what it's about. And, Anhelm Brilliant Savarin, way back in 1825, said the destiny of countries depends on the way they feed themselves. So let's really focus in on the nutrition side of it. It is absolutely critical for cellular health. And you have trillions of cells in your body. This is a great way to explain it to your patients. You have trillions of cells in your body, and each cell is like a microcosm of your entire body. It means each cell can breathe. Each cell can put off carbon dioxide. It can get rid of toxins. It has a life, like red blood cells, 110 days. Human body, 110 years. See the similarity? And we're able to take a look at the cells of the body and then determine actually the health of the entire body. And so it's a bunch, trillions and trillions of bodies, in one little cell, and it affects the whole. And so once we understand that, we can see the importance of delivering nutrition to the cell level. And once we do that all the other treatments to be holistic are only going to work better. They're only going to work better. And so let nutrition in your clinic be a focal point. If it's not your specialty, it's okay, but have it be a focal point. Make sure that you're teaching nutrition. Are you giving your patients things to read? Are you teaching them the basics of what they should be eating on top of the vitamins and nutrients you're giving from a therapeutic standpoint? If not, create a system so that every patient is being taught nutrition and that they have assignments, because you don't have the time to spend Should you do webinars? Absolutely. Should you do seminars and that with your patients? Absolutely. But for the most part, your patients are going to better be educated by you giving assignments to them and then making a note on their chart on their next visit. Did they truly follow up? So for example, wrote a book called Nutrition 101. Nutrition 101 is the basics about what's a carbohydrate, a protein, a fat, what foods are healthy carbs, proteins, and fats, which ones are unhealthy, and just the basics. What if you prescribed to your patient either my book Nutrition 101 or someone else's that teaches the basics and said, all right, your next visit is in a week or your next visit's in a month. Well, in that amount of time, you could get through the first 2 chapters and I want you to report back to me on what you read. Simple as that. You're spending not even 30 seconds giving an assignment. They're going out and spending the minutes or the hours doing it and reporting back to you. That's all it takes to be able to focus in on teaching nutrition. And nutrition is critical for the health of the human body. The nutrition is taking the nutrients, assimilating and utilizing them. So doctors, this podcast is really about driving back home to you the importance of nutrition and being a holistic clinic. You don't have to become an expert in that. You have to be associated with those who are. So whether you pick me or you pick someone else, get with them, make sure they provide you the materials to educate your patients without you spending a lot of time, like Nutrition 101. We'll put a link in here so you can download the PDF of this for free, be able to get. We're also getting a bunch of these in so you can actually be able to get them to your patients in hard copy and make that available to you. But whether it's Nutrition 101 or something else, find ways to educate your patients, give them assignments so that nutrition can be in the forefront of their mind so they can be helped at the cell level. So everything else you do in your clinic will benefit them that much more. Give nutrition a shot. Have a great day.